This tutorial covers how to submit 2024 data in our online data portal to receive a 2025 Achievement Award for the American Heart Association's Outpace CVD program, Check Change Control Cholesterol. Log into the data platform at aj.infosarioregistry.com/login using the username and password sent to you via email after registering. This slide contains further details on how to register your organization and get a user account. You will submit Check Change Control Cholesterol data through program forms. Click either the icon under Get Started or the link in the left navigation panel. If your organization has submitted in the past, you may have existing forms under the Edit Form section like I do here. Each date represents the calendar year from which that data was collected. For 2025 awards, you'll need to submit a 2024 form. You or another member of your organization may have already started entering your 2024 data for recognition. So check if you already have a 2024 program form for Check Change Control Cholesterol. If so, you can click that and start adding data. I don't have a 2024 form yet for Check Change Control Cholesterol, so I'm going to click Add New next to that program. I'm submitting for a 2025 award, which is based on 2024 data. So I'll type 2024 in the reporting year field and hit Submit to start the form. Check Change Control Cholesterol has two tabs of data to enter, which you can see under Tabs on the right. The first tab, Participant Information, contains questions about your healthcare organization, including your total adult patient population in question 3, a breakdown of your patients by race and ethnicity, as well as a breakdown by payer group. The gray boxes on questions 5 and 6 cannot be edited. They auto-populate to total the number of patients entered above. That's because the patient breakdown by race and ethnicity, as well as by payer, must equal your total patient population that was given in question 3. Next are questions surveying your use of the ASCVD risk score. You must answer yes on question 10 to be eligible for an award. The final question on the first tab is about your quality improvement activities. Let's scroll back to the top. Tab 2 includes the measure denominator and numerator questions that will determine your measure performance and award status. Note, filling out both tabs, participant information and measure submission, is required for an award. Once all fields are complete and no errors are detected, return to the Participant Information tab where the Data Entry Complete checkbox will now be available. Check this box to mark that you are finished entering data and then save. You can save or save and exit and come back at any time to revise your data. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline, but you can revise your data at any point up until this snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or the top right to orient yourself. I recommend having the data collection worksheet available or filling it out ahead of time for ease. You can find this worksheet by navigating to the library on the left. I'm right-clicking to open in a new tab. In the library, click on Check Change Control Cholesterol Data Collection Worksheet to download the PDF and then open it from your desktop. Questions may change from year to year, so please ensure that you have the latest data collection worksheet, which you can find by looking at the top of the first page. The worksheet contains additional guidance on how to answer each question, especially for question 6, which asks for that patient breakdown by their primary payer. Scroll to page 7 for detailed guidance. Let's go back to the program form. Here, you can also use the official measure specifications, which can be opened directly from the program form by going to the Measure Submission tab and clicking the measure description link for MIPS 438 Statin Therapy. I'm right-clicking to open the link in a new tab to have on hand if needed. Let's return to the Participant Information tab to get started. The first question asks if your organization diagnoses and manages patients with high cholesterol, up to and including prescribing medications. A yes response is required to be eligible for a 2025 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2025 award. Question 3 asks for the total adult patient population ages 18 and above who had a 2024 visit for your organization. Please exclude acute care visits from this total, as well as other visit types where high cholesterol could not be diagnosed or managed. When pulling data for this question, please make sure that you are saving this query and can further break down that same patient population by race and ethnicity and by payer group. My demo organization has 42,897 patients ages 18 and above. For question 4, input how many providers your healthcare organization has. We are looking for all clinicians, physicians, nurse practitioners, and physician assistants in your outpatient organization. My demo organization has 92 providers. In question 5, we ask for a breakdown of how your total adult patient population ages 18 years and older self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2024 Health Center data. The same question appears on our Target BP and Target Type 2 Diabetes program forms, so you may already have this information available. All fields must contain a value. Please enter a 0 where there are no patients. Here's the data that I have. The final 3 fields are inclusive of all patients who have either their race, ethnicity, or both unknown or undisclosed. If they have identified as Hispanic, Latino, or of Spanish origin, but not disclosed their race, place them in the first of these 3 final fields. If they have identified their race, but not their ethnicity, place them here. And finally, if you know neither their race nor ethnicity, place them in the final field. Once all the fields are filled in, an automatic total of what you have entered populates at the gray box at the bottom. This box must equal your answer to question 3. For question 6, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which group is considered your patient's primary payer? Use the guidance on the last page of the data collection worksheet for questions. Here's the data that I have for providers and payers. If you're still not sure on some patients' payer groups, put them under the Other Unknown category. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. If it does not, say I change my other unknown patients to a 0, an error will appear at question 3. Because it's a red error, I won't be able to save. For red errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear. This allows me to save and come back later once I have identified the error in my data. However, all fields must be filled in to be eligible for recognition. So in order to fully fix this, I must eventually either revise question 3 or my payer group totals so that they match up. Questions 7 through 11 ask about your organization's use of ASCVD risk estimation and treatment plan for very high-risk patients. ASCVD stands for atherosclerotic cardiovascular disease. The American Heart Association advocates for ASCVD risk estimation tools which enable healthcare providers and patients to estimate 10-year and lifetime risk for atherosclerotic cardiovascular disease or denote very high-risk patients for secondary prevention. Question 7 asks if your organization calculates risk for ASCVD using the Pooled Cohort Equation CV risk calculator. If yes, follow-up questions appear asking if the calculation is performed within your EHR or outside of the EHR. My demo organization calculates ASCVD risk within our EHR. Question 8 asks if your organization documents the ASCVD risk score. If yes, where? A discrete field in the EHR, meaning its own standalone field, or in a notes section or other non-discrete field in the EHR. My demo organization documents our risk score in a general notes field, not its own specific field. Question 9 asks if your organization operationalizes a specific treatment plan for managing patients considered very high risk for future ASCVD events. If you answer yes, we'll ask for more details about what that plan includes. Note that you must answer these follow-up questions. Leaving these unanswered generates a red critical error, which will prevent you from saving your form. My organization's treatment plan includes the detailed collection of past medical history and educating care teams every 12 months. Question 10 asks if your organization is committed to continuously improving use and data capture of ASCVD risk estimations. You must answer yes to be eligible for an award. Selecting no generates a note that tells me I'm ineligible. Make sure to save as you go. Question 11 is a new question in 2025. The American Heart Association launched a new tool in November 2023 to predict a person's long-term risk of cardiovascular disease. The Predicting Risk of Cardiovascular Disease Events, or PREVENT calculator, aims to help clinicians implement risk assessment for cardiovascular disease and facilitate clinician-patient discussion to optimize prevention for cardiovascular disease, including ASCVD and heart failure. This tool factors in kidney disease and metabolic disease, including type 2 diabetes and obesity, as well as indicators of social deprivation. We ask you to describe your organization's familiarity and use of the PREVENT calculator. At my organization, some clinicians use the PREVENT tool as a standalone tool, but it's not yet integrated into the EHR. We've also added a new question this year about your quality improvement activities. Your response, while required, will not affect your award level. We want to know which quality improvement activities for high cholesterol and/or ASCVD management your healthcare organization engaged in during 2024. Please select all options that apply. The final questions are housed in the Measure Submission tab. This can be accessed by clicking the blue icon with 4 lines or the Next button at the bottom of the screen. Questions 13 and 14 are used to calculate your organization's performance on the measure and your subsequent award status. Please note, you must use the MIPS number 438 measure criteria as specified. Using a different measure, using a custom definition of at-risk patients, or pulling in only patients with ASCVD is not acceptable for award eligibility. Question 13 is the denominator of the MIPS 438 measure. This denominator asks for patients who had an office visit in 2024 and who are considered at high risk for a cardiovascular event under the American College of Cardiology and American Heart Association guidelines. Using MIPS 438 logic, which again can be found in the measure description link, how many patients fall into any of these 4 risk groups? Note that though it says or between each group, you're not picking a single group for your denominator. You are analyzing your patient population to determine all patients who fall into one or more of these risk groups. The risk group criteria has changed slightly since last year, including the addition of the 4th risk group. When calculating, you can determine how many patients are in each risk group and provide the sum of all 4, but be careful not to double count patients who fall into more than one risk group. Make sure to save this end result of patients so that you can calculate your numerator. The risk groups criteria are 1. All patients, regardless of age, who are previously diagnosed with or currently have an active diagnosis of clinical ASCVD, including an ASCVD procedure, or 2. Patients aged 20 to 75 years who have ever had a laboratory result of LDL-C that was greater than or equal to 190 milligrams per deciliter, or were previously diagnosed with or currently have an active diagnosis of familial hypercholesterolemia, or 3. Patients aged 40 to 75 years at the beginning of the measurement period with type 1 or type 2 diabetes, or 4. Patients aged 40 to 75 years at the beginning of the performance period with a 10-year ASCVD risk score of greater than or equal to 20%. Make sure to exclude certain patients from all calculations based on the measure requirements, such as patients who are pregnant or breastfeeding. Question 14 is the numerator of the measure. Of the patients who fell into the denominator, question 13, how many were prescribed or were actively using statins in 2024? Time to enter my answers to questions 13 and 14. My demo facility had 1,856 patients in the above risk groups. You can see that an additional question has appeared. This won't appear for everyone. It popped up for me because my answer represented less than 6% of my total patient population that I gave back in question 3. Because it's unusual for such a small segment of patients to be in any of these risk groups, we need to know a little bit more about how you pulled this data. Question 15 asks if you determined your risk group patients based on a sampling or subset of patients rather than the full population. If yes, question 16 appears and asks for a brief description of your sampling method and reason for sampling. Make sure to include your initial population sampled, sample size, and selection methods. If you did not sample, question 17 appears instead, requesting that you double check the measure logic. Remember, the denominator represents patients in all of these risk groups, not just one. If your query was correct, let us know why your organization's population might be unique. Please note, if these additional questions appear to be eligible for an award, you must either 1. Revise your denominator data to be more than 6% of your total population, or 2. You must answer all of the new questions to the best of your ability. This year, we've also added a couple of additional questions, and we'll walk through those together now. The first that you might encounter is in question 13. If you have only 10 or fewer patients in the denominator, then question 13A will appear. We'll ask for context on why your denominator is small and, if applicable, why your overall patient population may be small. Examples may include unique characteristics of your patient demographics or location. The second conditional question is 14A. This will appear if your performance on the measure is at or above 90%. Please verify your data and, if accurate, provide details that may be contributing to your above average performance. For my demo organization, after double checking my measure logic, I realized I had incorrectly calculated one of the risk groups. My real denominator is 9,041. Finally, of my at-risk patients, 6,930 were prescribed or using statins. Once all fields have been entered, return to the Participant Information tab. The last step in our submission process is to check the Data Entry Complete box. An important note: if this checkbox cannot be populated, it means that your data is incomplete and you may not be eligible for recognition. Please review both tabs and ensure that no fields are left unanswered before exiting. I am unable to check the box. Scrolling through my questions, I can see that it is because I left the other unknown box in question 6 blank. Now that is corrected, I should be able to check the Data Entry Complete box, which ensures that I am ready for recognition. Finally, I'll click Save and Exit. Back under Program Forms, you can see that I now have a saved 2024 form for Check Change Control Cholesterol. You can go back and edit your data at any time before the data submission deadline. As long as your data is complete by that time, you are considered eligible for an achievement award. Look out for regular newsletters and additional communications from us to learn more about recognition. Thank you for choosing to submit data for Check Change Control Cholesterol. If you have additional questions, please contact us at bit.ly/AQContactUs, or if you need help logging in, you can contact our platform vendor using the email address on screen now.